Why does a meniscus tear happen? Hi, I'm Dr. Justin Lin, sports physical therapist at Rehab and Revive. Let's get to these answers shortly, and then I'll show you a simple exercise to keep it from getting worse or even jumpstart your healing. All right, let's get straight to it. What is the meniscus actually doing? Think of the meniscus like a tough, rubbery shock absorber sitting between your thigh bone and shin bone. Its job is simple but critical. Distribute load, protect the cartilage, add stability during rotation and bending. Research has shown the meniscus takes on up to 50% of the load during standing and up to 85% during deeper knee bending. It's doing way more work than you think. So why does a meniscus tear actually happen? 3 big reasons. 1. Degeneration over time. Once you're past your 30s, the meniscus begins to lose hydration. It becomes more like dry leather than a spongy pad. Even small twists or compressions can overload it. Number 2, poor mechanics. When the hip, ankle, or foot isn't doing its job, the knee takes the hit. Collapsed arches, weak hips, limited knee extension. These all funnel abnormal forces right into the meniscus. Number 3, sudden force or twist. In athletes, this usually happens during cutting, pivoting, or landing awkwardly. The meniscus gets pinched between the bones and snap, it can shear. Here are different types of meniscus tears and what they mean. Not all tears behave the same, and here's the simple breakdown. Longitudinal and vertical tears. They often happen from twisting injuries to younger athletes and have a higher healing potential. These can progress into a bucket handle tear. Bucket handle tears. A flap flips into the joint and blocks the motion. The classic sign, you can't fully straighten the knee. These often need surgical intervention. Radial tears. We see these with compression and rotational overload. They cut across the fibers and disrupt load distribution. They're harder to heal naturally. Horizontal cleavage tears. They're common in degenerative knees. Overuse and aging play a role. And complex tears, a combination of the above. Usually they're chronic and degenerative. Here's the good news. Even if the tear itself doesn't fully heal, we can dramatically reduce pain and improve function by restoring mechanics and reducing the compressive overload. And that brings me to a simple exercise that moves the needle fast. Terminal knee extensions. TKE. Why this works? It restores your knee's last few degrees of extension, something almost always lost after a meniscus injury. When you lack full extension, the meniscus gets wedged and irritated with every step. Terminal knee extensions activate the quad, they unload the meniscus, and help align the joint. Think of it as giving the knee a mechanical reset. All right, so anyone who's done terminal knee extensions may have used bands, but I love having a ball. If you want to place a ball behind the crease, that's probably an ideal place. The ball's great because as you increase tension, the ball pushes back. And so that's a great thing because that mostly resembles push off. And so how hard you want to press the balls up to you or how much you want to back in, and that's the most important. So what we're going to want to do is you're going to keep your feet flat and then keep your heel down, and then you're going to extend this slowly and then slowly get it bent. And that's the work you're going to want to do, is work on the eccentric. What's going to happen is you might shake, you might slowly let it snap because it's weak, but your goal is to slowly let it bend. And that's the most important part of this exercise. You're going to do a number of these, 30, 40, 50. It's going to burn. That's good. You're going to hit different parts of these muscles, quads, calves, hamstrings. You're going to feel. We've done these exercises in the past. If you want a more full, detailed explanation of the terminal knee extension,
We have it in the descriptions box below.
Let us know your thoughts on our video. Leave us some love or questions in the comments box below. Please like and subscribe. We appreciate your support. I'm Dr. Lin. Remember, we heal smarter,